If you are over 60 and you experience dizziness regularly, there is a good chance you have been told the same thing most older adults are told, that it is just part of getting older, that it is normal, that there is not much to be done about it. That explanation is incomplete, and in many cases, it is clinically incorrect. Dizziness is the most common complaint reported to primary care physicians by adults over 60. It is also one of the most frequently dismissed, but research consistently shows that persistent or recurring dizziness in older adults has identifiable causes in the majority of cases. Those causes are treatable, and missing them has real consequences that range from reduced quality of life to serious injury and preventable falls. Today, I am walking you through the most important medical causes of dizziness after 60 that are routinely missed or misattributed to aging, and I will tell you exactly what to ask your doctor and what tests belong on your list.
Welcome back. On this channel, we focus entirely on health after 60 because the symptoms that matter most at this stage of life are often the ones that get the least attention. Before we go through the causes, it is important to understand that dizziness is not a single symptom. It is a category, and the type of dizziness you experience tells the clinician something specific about where the problem is coming from. Vertigo is the sensation that the room is spinning or that you are spinning when you are not moving. It is typically caused by a problem in the inner ear or the brain pathways that process balance information. Presyncope is the feeling of almost fainting, lightheadedness, the sense that you are about to lose consciousness. It is typically caused by insufficient blood flow to the brain. Disequilibrium is a feeling of unsteadiness or imbalance without a clear spinning sensation. It is often associated with neurological conditions or musculoskeletal changes. When you speak to your doctor about dizziness, describing which of these three best matches your experience is one of the most useful things you can do. It changes what gets investigated. Let us go through the conditions behind each type. Cause number 1: benign paroxysmal positional vertigo. This is the single most common cause of vertigo in adults over 60 and one of the most treatable conditions in all of medicine once it is correctly identified. BPPV occurs when tiny calcium carbonate crystals in the inner ear, called otoliths, become dislodged from their normal position and migrate into the semicircular canals. These canals are responsible for detecting rotational movement. When crystals enter them and move in response to gravity, they send false movement signals to the brain. The brain receives conflicting information and interprets it as spinning. The hallmark of BPPV is that the vertigo is triggered by specific head movements: rolling over in bed, looking up, bending down. The spinning begins within seconds of the movement and typically resolves within 30 to 60 seconds. It is often accompanied by nausea and sometimes vomiting during severe episodes. The treatment is the Epley maneuver. It takes approximately 5 minutes and involves a series of guided head position changes designed to move the crystals out of the canal and back to their correct position. Clinical studies show it resolves BPPV in approximately 80% of cases after 1 or 2 sessions. It is performed by physical therapists and some physicians and can also be self-administered with proper instruction. If you have been experiencing positional vertigo and have never had this maneuver performed, that is the most important next step. Cause number 2: orthostatic hypotension. This is the most common cause of presyncope in adults over 60, and it is directly responsible for a significant proportion of falls in older adults. Orthostatic hypotension occurs when blood pressure drops significantly upon standing. Normally, the body compensates by rapidly constricting blood vessels and increasing the heart rate to maintain blood flow to the brain. After 60, the autonomic nervous system becomes less responsive, and this compensation slows. The result is a brief window after standing, during which blood pressure is too low to adequately supply the brain. Lightheadedness, visual dimming, and sometimes falls follow within seconds. It is defined as a drop in systolic blood pressure of 20 millimeters of mercury or more within 3 minutes of standing. The test is performed by measuring blood pressure lying down and then immediately upon standing. It takes less than 5 minutes and is not performed routinely during standard appointments unless specifically requested. Diuretics, alpha blockers, beta blockers, and certain antidepressants all significantly worsen orthostatic hypotension. Dehydration amplifies the effect. If you take blood pressure medication and regularly feel dizzy when standing, this interaction is the most likely explanation, and it is addressable through medication adjustment, adequate hydration, and simple behavioral changes such as sitting at the edge of the bed for 30 seconds before standing. Cause number 3. Cardiovascular causes including arrhythmia. Any condition that reduces cardiac output reduces blood flow to the brain. Atrial fibrillation, the most common cardiac arrhythmia in adults over 60, produces an irregular and often inefficient rhythm that can cause episodic dizziness without any other obvious cardiac symptom. Many people with atrial fibrillation have no awareness of their rhythm abnormality and experience only fatigue and intermittent lightheadedness. 6. Sinus syndrome, heart block, and severe aortic stenosis produce similar presentations. Aortic stenosis, in particular, is associated with dizziness, specifically with exertion, because the narrowed valve limits cardiac output precisely when demand is highest. Dizziness associated with palpitations, chest discomfort, or physical exertion should never be attributed to aging without cardiac evaluation. An ECG is the starting point. A 24 or 48-hour Holter monitor is the appropriate next step when paroxysmal arrhythmia is suspected. An echocardiogram is wronged when structural cardiac disease is on the list of possibilities. Cause number 4. Medication side effects. The average person over 65 in the United States takes 4 to 5 prescription medications daily. Many list dizziness as a side effect. More importantly, the interaction between multiple medications can produce dizziness even when no single drug at its individual dose would on its own.
The drug classes most consistently associated with dizziness in older adults are antihypertensives that lower blood pressure too aggressively, sedatives and sleep aids that affect vestibular processing and balance, certain antibiotics including gentamicin and streptomycin that are directly toxic to the inner ear, antidepressants and antipsychotics that affect autonomic function, and anticonvulsants that affect cerebellar function. Bring every medication you take to your next appointment, including over-the-counter drugs and supplements, and ask your doctor or pharmacist specifically whether any of them or any combination is known to cause dizziness. This conversation happens far less often than it should, and it is one of the highest value steps an older adult can take. Cause number 5. Central nervous system causes. The cerebellum and brainstem contain the central processing systems for balance and spatial orientation. When these structures are affected by ischemia, small strokes, or neurodegenerative changes, the result is dizziness and disequilibrium that is persistent rather than episodic and not triggered by specific head movements. The warning features that distinguish central causes from peripheral ones are critical to recognize. Dizziness accompanied by double vision, difficulty swallowing,
facial numbness, limb weakness or numbness, slurred speech, or severe headache is a neurological emergency. These are the symptoms of posterior circulation stroke. The brainstem and cerebellum are among the most commonly missed stroke territories because their presentation is less classic than anterior circulation strokes and more likely to be attributed to other causes.
Dizziness that is new, persistent, and accompanied by any neurological symptom, however mild, is not something to monitor at home. It is a reason to seek same-day evaluation without delay. Here is the practical summary. If your dizziness is positional and lasts less than a minute, BPPV is the most likely cause, and the Epley maneuver is the first step. If it occurs upon standing, request orthostatic blood pressure measurements and a medication review. If it is associated with palpitations or exertion, request an ECG and a Holter monitor. If it is persistent and accompanied by any neurological symptom, seek same-day evaluation. Dizziness after 60 is not a diagnosis. It is a symptom that deserves an explanation. And in most cases, that explanation is available if the right questions are asked. Have you been told your dizziness is just part of aging? Leave a comment below. I read every single one, and your experience might be exactly what someone else watching this needed to hear.
If this was useful, share it with someone over 60 in your life.
Dizziness is one of the leading contributors to falls and loss of independence in older adults. Knowing where it comes from is the first step to addressing it. And if you are not subscribed yet, new videos every week focused entirely on health after 60. No ads, no products to sell. I will see you in the next one.